Hello everyone, welcome you all to the Master Nursing classes. Myself Mr. Nagaraj, your nursing mentor and guide and AIMS nursing officer. So again here in front of you all today to discuss the most important topics of the eye disorder. So where we have left behind in the previous classes and continuing with that only, where we have discussed in detail things related to the anatomy, physiology, what is rod cells, cone cells, what is retina, what is choroid and what is sclera. What is conjunctiva and each and every possible questions which arises from the each layers of the eye we have discussed in detail. So in today's particular class we are discussing those very important topics and high yield topics that going to be prove very beneficial for your upcoming NORCET 6 exams and other all exams, very specially for the ESSC exams, DSSP exams and all the nursing officers exams. Where in today's class we are discussing the important first aid and all the disorders with their nursing management and the clinical features with a definitive finding in the diagnostic test. So whenever the question come from the eye disorders, the questions come in this manner only, and these questions will come in this manner only. So we will discuss those very root of the eye disorders where we will find the answer very easily in the exams and where we will get the rank and the better ranks in the upcoming NORCET 6 exams. Students, this class is going to be very beneficial for you. Watch the class till the end. If you found the information and the explanation is perfect, then don't forget to hit the like button and subscribe to the classes. So if you want more informative classes like this, we are having the Telegram group. The notification of the class will be delivered in our Telegram group. The link is there in the description box. Do join the Telegram group. Without wasting the time, we will start the today's class, and the first question of the class will comes like this in front of you. Yes. Read the question carefully, completely, and take your action as a nursing officer working in the AIMS. So think you are a nursing officer working in the AIMS and you are getting this particular scenario in front of you. Think what you have to do as a nursing officer of the AIMS. Yes. The question is simple. Which of the following is not a nursing intervention? When the patient comes with a penetrating object in the eye, what happened? The patient came to the hospital with a penetrating object in the eye. What is the penetration? Penetration is the thing that something is moving in our bodies. So something means any object which is soft object, which is hard object, which entered in our eye, especially the hard objects, if it is making a hole and entering our eye, so we call that is the penetration in the eye. Whenever the patient comes to you with the penetration of the hard object in the eye, so what is the intervention you have to do and what is the intervention you, you have to avoid there. Okay. So here in the question they have asked, following is the not a nursing intervention with the patient comes with the yes penetrating object in the eye. Option A is telling use the wet cotton to remove the object. Students, if any dirt, if any small objects like flies and organisms is entering in your eye and which is blunt in nature, so at that point of the time you have to use the cotton with wet saline and you have to move that cotton from the inner canthus of your eye to the outer canthus of the eye to remove that particular uh, non-blunt and non-penetrating object. If the patient coming with the penetration, never ever remove the object without any consent and without any doctor prescription. Students, is sometimes the penetrated object which holds the intraocular structure in a particular area where it should be there. If you are removing that particular object means the viscera, the internal things of that particular organs will come with that, so the further damage will occur. So as a nursing intervention, we will never ever remove the object which entered and penetrated in our eye. So this option A is telling is absolutely a wrong statement. So we will not use the wet cotton to remove the object. So this is used in the non-blunting and non-penetrated object entry into the eye. So this is not the answer for that one, and limiting the eye movement of the patient is a 100% answer, students. Why? Because this is our perfect nursing intervention. If something is there in the eye and we are moving the eye this right, left, up, down means that particular thing, the entered foreign body will damage the eye further. So in order to avoid that one, we will cover the both damaged eye and non-damaged eye. Why we have to cover the non-damaged eye? It's very simple, students. When we have covered the damaged eye and when we will keep the non-damaged eye open and some doctor is moving from this side to that side to this side means in the emergency department patient moves his eyes non-covered eyes in all direction. If one eye is moving means another eye also will move. If you want feel practically, close your eyes, keep close your one eye, keep a hand in your closed eye, okay, move your another eye. So if you are moving right eye means the left eye also moves. As I told, the object entered in the eye means we have to limit the eye movement. Okay, so in order to prevent the eye movement, we'll cover the both eye because students, if we are moving one eye means another eye also moves. So it is mandatory to cover the both eye in the emergency situations. And option C is there. Cover the affected eye with the paper or the plastic cup. It's 100% correct. And option D is there. Notify the patient immediately. Okay. So after coming the patient, he will decide whether to remove the object with the local anesthesia or whether need to take the patient for the OT to remove the object based on the object and the situation. So he will decide. Our thing is to nursing intervention is to not to remove it one. Okay. And cover the eye with the paper cup and plastic. Okay, it is our nursing intervention. So yes, who are given the option A as the correct answer for this question. I'm very proud of you all. Yes, this is the correct answer, and this is the intervention we should not do in the patient with a penetrating eye injury. Yes, there is the next question in front of you all. Yes, read the question properly. Okay, and give the best answer. The question is very simple. Which of the following is an the appropriate nursing intervention when the patient comes with a flashed chemical in the eyes? A person who is working in the chemical factories, the person who is working in the labs, and the students so who is doing the practical things in the labs. At that point of the time, there is a chance of the flashing of the chemicals in the eye. So what we have to do as a nursing officers in order to prevent the further damage by the chemicals to the eyes. So, which is the important nursing intervention we have to do here? Students, the answer changes here based on the question format. If in the question, the examiner asking that the patient comes to the hospital after the first aid means the first nursing intervention we have to do is to check the visual acuity of the patient. But here in the question, they have nothing mentioned. Means the first priority goes to the first aid students. Here the first aid is the immediately flush the eye for the 15 to 20 minutes. We have to flush the eye with the normal saline or any sterile water or tap water also okay. So we have to flush the eye for the 15 to 20 minutes. This is the first priority. Then after flushing, we have to check the pH. If the pH will comes to the 7 or if pH will comes to the neutral, it is okay. If it is still alkaline or if it is still acidic means we have to continue the flush again up until and unless the pH should comes to the normal. And option C is telling that checking the visual acuity. So if the patient comes to the emergency department after the first aid means this will take the priority here. If the patient comes to the emergency department without any first aid means, so option B is the thing which will take in the priority here. But the question is like this: which of the following is in the appropriate nursing intervention when the patient comes with the flashed chemicals in the eye? So examiner are not asked the priority in the question. So the all thing we have to do here is the option A. That is the option. Sorry, option B. Immediately flushing the eye for 10 to 15 minutes is the correct only. And after that we have to check the pH. And after that we have to check the visual acuity. All these three things we have to do. And the answer goes to this question is the option D. All the above is the correct answer. Hope the concept is clear. We'll move on to the next question. Yes. Here is the next question in front of you all. Very simple question. And consider this one as a 5-star question. Why? Because this question is simple. And the rationale I am explaining you all here is the which clarifies your next 4 questions. Okay, that is very helpful and very important components of your exams. Okay, so what is the normal intraocular pressure? Yes, so all are live to the class. Fadafat do comment for the question. Yes, very simple question. Very good, very good. Yes, if the examiner asking what is the normal portal venous pressure? What is the normal portal venous pressure? That is the 10 to 12 mm of Hg is the normal portal venous pressure. If the pressure in the portal veins goes to more than 12 mm of Hg, so we call this one as the portal hypertension, which primarily occurs due to the damage to the portal veins or which occurs due to the damage in the obstruction in the portal veins that is made due to the liver cirrhosis and the liver cancer condition. And option C is telling 5 to 15 mm of HA, and this is the normal. This is the normal intracranial pressure, students. This is the normal intracranial pressure. Okay. So if the pressure more than 15 mm of HG means there is chance of the damage to the brains and the herniation of the brains will occur. Okay. So this is the normal intracranial pressure. And option A is that 3 to 8 mm of HG. That is the normal. Yes, 3 to 8 mm is the normal. Very good, students. Central venous pressure is the normal 3 to 8 mm of Hg. And the answer for this question, yes, 12 are given the option B. Your answer is 100% correct. So that is the 10 to 21 mm of Hg is the normal intraocular pressure. If in case in the glaucoma condition where the increased production of the aqueous humor or due to the decreased absorption of the aqueous humor from the anterior chamber of the eye, there is raised intracranial pressure, there is raised intraocular pressure, so which damages our optic nerve and our retina and our macular area, so which may leads to the yes the transient slowly blindness we will see in the patient with the glaucoma due to the increased intraocular pressure. So the intraocular pressure is measured by our device. So already discussed with that device. That is the name of the device is yes, name of the device is tonometer. Okay, tonometer. Hope the concept is clear for this one. Yes, we are moving forward to the next question. Here is the next question in front of you all. So very simple and very beautiful and very important questions, friends. Yes, the question is very simple. Which of the following finding of the ophthalmoscopy indicates raised intracranial pressure in the head injury patient? Consider this one as in the five-star question. The findings of the ophthalmoscopy many times asked in the exams. Directly, indirectly, it will help to diagnose your disorders and predict you to get the right answer in the questions which will coming from the eye disorders. So these all five options I will explain here in front of you all. So it will help you a lot to determine the answer in the main exams. So okay, so focus over the explanation, and if anyone is knowing the answer, just do comment for the answer. So I am giving the time to give the answer for you all. Okay, so yes, you have to tell where is the cupped optic disc will be seen, where is the presence of the red reflex, yes, where is the swelling in the optic disc, that is the papilledema. Okay, so cotton wool spot where we will see, and brucin, that is the small yellow parts where we will see. Yes, Fatafa do comment for the question. It's a very important question and the five-star question which will comes in front of you from the eye disorders. Yes, Fatafa do comment for the questions, friends. Which of the following is the finding of the ophthalmoscopy? Yes, that indicates the rise in intracranial pressure in the head injury. Can anyone tell the answer here? This is what we call the optic disc. Okay. So whenever there is the increased intraocular pressure, so it creates the pressure in the this direction where we are seeing the yes the cup shaped optic disc. Means yes, like this we will see the optic disc. This is what we call the cup-shaped optic disc. This is we will see in the raised intraocular pressure. So raised intraocular pressure means which disorder that is indicating the glaucoma. Okay, that indicating the glaucoma. If the examiner giving any evidence where the optic disc is looking cup in shape, so always and always think about the yes, that is the increased intraocular pressure due to the glaucoma. Okay, so the next one is the presence of the red reflex. Students, whenever after instilling the any anticholinergics drugs like atropine and tropicamides, so we will dilate the pupils. Okay, we will dilate the pupils by injecting the some anticholinergic medication. After that, so we will use the red light to visualize the entire fundal organs of the our eye. Okay, so at that point of the time, there should be entire eye insert should be a red in nature. So that is what we call the red reflex. So red reflex should be normally present. If in case the red reflex is absent, means that is indicating yes, that is indicating absent of the red reflex plus presence of the white reflex. So that is indicating as an cataract. What is the cataract? Cataract is the condition where there is an opacity of the lens occurs. So the light bending ability, the accommodation ability, and the ability of the lens to change in the position and focus the light exactly over the retina will get decreases because the decreased uh, light and bending ability and increased opacity of the our lens. So that is what we call the cataract. Due to the degenerative changes in the lens become white in color. So whenever we will see the eyes of the old age persons, that is more than the 60, 70 years, we will see the whitish color in the our cornea. So that is because of the opacity of the lens. So that is what we call as in the cataract. Okay, so in the cataract there is a absent of the red reflex and the presence of the white reflex we will see in the patient with the cataract. Okay, so the presence of the red reflex is a normal. Okay, so if we are getting it absent, that is the finding of the our cataract. Okay, so option C is there, swelling in the optic disc. Swelling in the optic disc, we will say this one as in the papilledema. So the swelling in the optic disc occurs. Students, very simple concept you have to remember. As I told, when there is in the increase in the intraocular pressure, the cup-shaped optic disc we will see. Okay. So if in case of the increased intracranial pressure means yes, it creates the pressure. This is for the your general understanding. I am telling. Okay. It creates the pressure from the cranium means from the brain. So at that point of the time, we will see the yes bulged and swelling optic disc like this. If it is like this means that is the cupped. So we are if it the optic disc is coming like this means this is what we call the bulged or swelling optic disc. So this is we are it is indicating clearly that there is in the papilledema. The papilledema occurs due to the increased intracranial pressure, not due to the raised IOP. Remember and give best shot in the exams for deciding the rank in the exams. Yes, this is the answer and the brand answer for this question. And who all are answering option C as a answer for this one? Yes, that is the 100% correct answer, students. I'm very proud of you all. Okay. So here is the next question in front of you all. Yes, give the answer. Read the question properly and try to predict the answer. Not to predict the answer. If you know the answer 100% and perfect, give the answer. If you don't know the answer, don't give the answer. Students, in the exams also, remember that for this year, they have changed the exam pattern. All of you know that it is in the yes 5 section 20 questions. Okay, for mains and for prelims also. Remember that if you know the answer, give the answer. If you don't know the answer, skip the question. So out of this 20, if you are attending only and only 14 questions and you are skipping 6 questions also, among these 14 questions, you are very sure about 13 question means, so from each session you are making the only 13 question right means, okay, how many marks you will get, as you know, yes, around you will get the yes, 65 marks you will get, students. Only you are making the 13 question correct. and among the 14, 13 will be getting correct means maximum your 5 answers may get wrong here. So you are attempting 70 question, and among the 70 question, only 5 is wrong, 65 is correct means, so your around marks will become say 64 something. If you are getting this many marks after deducting and after removing the negative means, so your rank will be in the top 100. So make a strategy, do a practice properly in correct direction. Okay. So if you know the answer, give the answer. If you don't know the answer, skip the question. So there is not any sense to give the wrong answer and deduct your marks of the correct question also. Okay. So this is the advice from my side. Okay. So focus over the content, and if you are really understanding the question, and if you are sure about the answer, then yes, give the best shot in the question. Okay. So here is the question in front of you all. Among the following given, okay, this is some question mistake here. So this is a not given. This is the given. Okay. So among the following given alternatives, which one not a clinical picture of the our open angle glaucoma? So whenever the patient comes to the hospital with open angle glaucoma, so which among the following is a not a clinical picture? Students, tunnel vision. What is the tunnel vision? Tunnel vision is the something whenever we will see towards the outer environment, we are unable to see the right thing and the left thing. Only thing which is there in the proper direction with us is only we are able to see, and only a thing which is directly in front of us is only we are able to see. So we are unable to see the periphery. We are able to see only a central thing. So that is what we call the tunnel vision. What is the tunnel? All of you know. So yes, the tunnels of the rails you have seen. Okay. So this is the tunnel. Okay. So where our railway moves from the tunnel. Okay. So only this much thing a railway driver is able to see here. Okay. So means he is unable to see the right and left, only front thing we have to he is able to see here. So by comparing to this tunnel, they have given the name of this one as a tunnel vision. Okay. So tunnel vision is a simple thing where we are unable to see the right side, unable to see the right and left side. We are only able to see the focus of the front area. So that is what we call tunnel vision in the glaucoma. Okay, whether it may be open angle glaucoma, whether it may be closed angle glaucoma. First, peripheral vision will get lost. Okay, and the central vision remains intact. So the painless peripheral vision loss is a classical and the beautiful clinical picture of the yes the open angle glaucoma, where the painful loss of the vision, which is indicating the closed angle glaucoma. Remember, students, yes, very good. Who all are given the answer as option D. The painful vision loss is not a clinical picture of the our open angle glaucoma. The painful vision loss is a clinical picture of the our closed angle glaucoma. Students, very important. Okay, so headache and hollows around the light and the tunnel vision are the classical picture of the open angle glaucoma. Okay, so the pain hyper aemia of the our eye. Okay, and very importantly, the patient is also having the profuse sweating and bradycardia. Okay, that is due to the visceral pain. Okay, if the examiner given the severe pain in the eye, bradycardia, profuse sweating, that is considered always and the acute closed angle glaucoma, and that one is the medical emergency. We have to treat that one immediately and very immediately. We are not treating the acute closed angle glaucoma immediately and properly. So that permanent blindness will occur within a 3 to 4 minutes. Okay, that is due to the uncontrolled increased intracranial pressure because of the closed angle between the cornea and the iris. So, hope the concept is clear for this one. Okay, so that is the explanation of the clinical features of the open angle glaucoma. Okay, in the open angle glaucoma, we will never ever see the painful vision loss. There is in the painless vision loss is the classical picture of the open angle glaucoma, and painful vision loss is the classical picture of the our yes, very beautiful closed angle glaucoma. Okay, so hope the concept is clear. Okay, and here is the next question in front of you all. Take a deep breath. Okay, so give the best to best answer for this question. Yes, the question is very simple, students. Yes, if you are having any doubt related to the any question, you can do comment in the comment box in the live session only. So I can answer to your questions. Okay. So here is the next question. Which of the following is the as the pupillary finding indicative of the hemorrhage in the pons? So what is the pupillary findings that indicating the hemorrhage in the pons? Yes. Students, as per the option, I will draw the image in front of you all. This is a very important question. Consider this one as the first question. And remember this one, as I am telling like this only. Unilaterally dilated pupils. This is right, this is left. Okay. So this side the pupil is completely dilated and this one is the constricted. So we can say this one as in the unilaterally dilated pupil. Okay. And here it is a bilaterally mid-positioned fixed pupils. Means completely dilated mid-positioned fixed pupils. That is both sides. Okay. And the third one is the pinpoint pupil. Okay. Here only almost completely constricted pinpoint pupils we are having here. So, if the examiner asking which kind of the pupillary reaction we will see in the patient with the third cranial nerve injury. Third cranial nerve injury, that is the unilaterally dilated pupils we will say in the, we will see in the patient with the oculomotor nerve injury or the third cranial nerve injury. So, and bilaterally mid-positioned fixed pupils you will say in the patient with the mid-brain injury. Okay, in the mid-brain injury, students, whenever the patient comes with the organophosphorus poisoning, okay, and whenever the patient comes with the bleeding or the hemorrhage in the pons, so fontanine hemorrhage or the fontanine hemorrhage or the bleeding in the pons, or we can say the organophosphorus poisoning. So at that point of the time, we will get the yes the bilaterally pinpoint constricted pupil we will see in the two conditions classically, that is the OP poisoning and in the asking the question here that is related to the yes the pupillary findings indicating that the hemorrhage in the pons, that is the pinpoint pupil is the our answer. Okay. So if the examiner asking, so yes, the pupillary reaction that is due to the damaged third cranial nerve, that is the unilaterally dilated pupil, and that is if the examiner asking the pupillary reaction in the midbrain injury, that is our very important bilateral mid position pupils will say in the yes. Yes, here is the question in front of your next question. It's the very simple question. Which of the following is in the drug contraindicated in the glaucoma? So now tell me, what is glaucoma? Glaucoma is the increased intraocular pressure which leads to the damage of the our optic nerve. Okay, so which is the optic nerve? Is this first cranial nerve or the second cranial nerve? So response me फटाफट. So all are live to the class. Is that optic nerve is the first cranial nerve or the second cranial nerve? फटाफट do response. Yes, all three cranial nerves originates with the O. First one is the olfactory nerve that is responsible for the smell. The next is the optic nerve that is responsible for the vision. And third one is the oculomotor nerve that is responsible for the movement of the eye. Okay. So yes, all these three first cranial nerves, all these cranial nerves which starts with the O. Okay. Very important. Remember. Okay. Don't get confused. Optic nerve is the second cranial nerve. Okay. So here, due to the increased intracranial pressure, there is damage to the yes the second cranial nerve will get damaged. So because of that, there is the blindness will occur. Okay. Because of the damage to the our second cranial nerve, the blindness will occur. Remember. So which drugs we will give in the treatment of the glaucoma? This is the very important. Okay. Special percent for you all. Okay. So option A is telling that the pilocarpine. Option B is the atropine sulfate. Option C is the acetazolamide, and option D is the timolol. So now tell me, what is the reason where we are using the pilocarpine? Remember, friends. Remember this physiology. that will help you to give the answer in the main exam also. Okay, so let me change the pen color. This is our beautiful cornea. Okay, and this is our sclera outer layer. This is our okay. This is the choroid layer, and again this is the our iris. This is the our ciliary body or choroid body. This is the our beautiful yes choroid layer. That is the middle layer, and inside we are having the sensory neuronal layer. That is the retina. Very important. You have to remember. There is one depression in the retina, so we call that one as the macula, and this is the spot where we are unable to see. So here there is the zonular fibers or the suspensor ligament which holds the our beautiful yes lens. Okay, so this complete posterior part of the eye is filled with the vitreous humor, and this complete anterior part of the eye is filled with the our aqueous humor. So in between the iris, this particular iris muscle which divides the anterior part into the anterior chamber and the posterior chamber. So the part which is front to the iris is the our anterior chamber. Okay, and the part which is posterior chamber. Okay, we call this one as in the posterior chamber. And from the ciliary body, our aqueous humor will get produced from our ciliary body. Okay, so if the examiner asking where it get produces in the posterior chamber of the anterior part of the eye is the your answer. Okay, so and here we are having the trabecular meshwork. Okay, so it will get produced here and close through the anterior chamber and get absorbed through the our trabecular meshwork. Okay, so very importantly the aqueous humor production and absorption. So in between the production and absorption, there is one muscle we call this one as the iris muscle, which creates the angle with the our cornea. So the angle between the iris and cornea, so this will be more than 45 degrees. Okay, this should be more than 45 degrees. Means iris muscles will get constrict. Whenever the pupil get constrict, the iris muscle will get dilate. So what is the pupil? Pupil is the gap between the two iris muscle. So this particular gap between the two iris muscle we call the pupils. So whenever these muscles, these iris muscles will get constrict, this pupil size will increase. That is what we call the mydriasis. Whenever there is in the pupils get constrict means this pupillary means this what we call the this particular muscle will get dilates, so that is what we call the meiosis. Very important, remember. Okay, so as I told, the 45-degree angle will get produces between the our iris muscle and our cornea. So this angle should be open for the absorption of the aqueous humor. If in case we are using the mydriatics, means the drugs which we are using to dilate the pupils means that is constricting the our iris muscles. If the iris muscle is just constricting means the angle will get closed. Already we are having the patient with the glaucoma with increased intraocular pressure, and with the drug we are closing the angle means it will further increase the intraocular pressure. So never ever use the drugs which causes the mydriasis in the glaucoma. If we are using the mydriatics means that again closes the angle and the worsening of the symptoms occurs. As a pilocarpine drug, it will yes ciliary muscles and which will constrict our pupils. So that helps to open the our angle between the cornea and iris. Okay, so opening of the angle which helps to as the absorption of the our aqueous humor, where the raised ICP will get decreases and ICP will comes to the normal. So miotic medications, that is the our so-called pilocarpine we will use in the glaucoma, and yes the atropine as the anticholinergic medication which is used for the mydriasis. So this one we will be never ever used in the patient with the is the yes astazolamide is the Yes, which diuretic this one? Carbonic anhydrous diuretic. We are using this one to reduce the production of the our aqueous humor, and timolol is the beta blockers. This astazolamide and helps to reduce the production of the aqueous humor. We are decreasing the production of the aqueous humor means the IOP will get reduces. So astazolamide will taken as in the drug of choice for the our glaucoma, and pilocarpine will be used for the lifeline of the patient with the glaucoma. Okay, so always explain to the patient glaucoma is not completely curable, but it can be, yes, controllable. You have to educate to the patient. Okay, and it is necessary to take the pilocarpine throughout the life of the patient in order to keep the intraocular pressure in the normal range. Okay, hope the concept is clear for this. And other medications which are uh, acting as a mydriatics, we will never ever use in the patient of the glaucoma. Remember, nursing officers, and give the best answer in the exams. Okay, so here is the next question in front of you all. Okay, very beautiful question and very important question. Yes, this question is a 5-star question for you all. Again, okay, students, this class will be somewhat lengthy. I'm trying to cover your huge syllabus by giving the clear concept that will really helps you all for the your upcoming Masters 6 exams. So be cool, calm, quiet, be with your register and pen. Note the point what I am telling, where I am using the word classically, importantly, beautifully. That words you have mentioned. Focus over the diseases and what I am telling as a classical pictures, and what is the findings, and what is the clinical manifestation and management of that particular thing. So that is the very important thing, and that is the only thing that will help you in the exams. Okay, so wherever I'm using the word important, classical and all, just do mention there, and revise once after the class completes, so that will fits completely in your mind. Okay, so be connected completely till the end. Okay, so the next question is like this: which of the following is an important surgical intervention done to treat the glaucoma? Very very simple thing. So whenever, yes, the particular angle which is there here in between the iris and cornea. So at that particular area, we are having the one uh, whole like structure. So that is what we call the trabecular meshwork. So if in case any blockage in that trabecular meshwork, that is what we call the open angle glaucoma. Okay, the angle will be open, but the trabecular meshwork will get blocked. Okay, and if in case any closer in that particular angle, so we call that one as in the closed angle glaucoma. In the open angle glaucoma, yes, the angle will be meshwork. Okay, and yes, this is the iris muscle which is dividing the anterior and posterior chambers of the eye. So that is also having the very vital and important role to decide the angle between the our, yes, iris and cornea. Okay, so what is the exact important surgical intervention we have to do for treating the glaucoma? Students, as I told in the open angle glaucoma, yes, consider this one as in the cornea. Okay, and this is the iris muscle. What I told, this one is the, yes, trabecular meshwork. Okay, so from here it will get process from the ciliary body, and it will move like this, and it will get flow absorbed here. Yes, it will create the uh, thing where it will increases the intraocular pressure. Okay, that leads to the open angle glaucoma. So we will open this one surgically, and we will repair this trabecular meshwork. So that is the particular thing we will call the trabeculoplasty. And sometimes in the closed angle glaucoma, due to the closed angle between our cornea and iris because of the construction of our iris muscle. So at that point of the time, we will do the complete iridectomy or the partial iridectomy in the closed angle glaucoma. So iridectomy is also a surgical intervention that we are doing for the glaucoma. Okay, so it may be a partial iridectomy or it may be a complete iridectomy. So remember that after removing the iris, so always and always advise the patient to wear the black color glasses. Okay, whenever he will expose to the external light. Okay, that is very much important. Otherwise, it will create the flash. So this particular two surgeries we are doing here to treat the glaucoma. That is the trabeculoplasty. So in order to open the trabecular measure, and iridectomy in order to open the angle between the iris and cornea. So option D was the correct answer for this question. Yes, A and B both we are doing here. Okay. So and the LASIK surgery we are doing in the as the management of the or keratomyelitis. Okay. So yes, LASIK here is the laser assisted in situ keratomyelitis. Okay. Here we are using this one to repair the cornea. Okay. So hope and here is the next question in front of you all. So the question is very simple. I am waiting for your answer here. Opacity of the lens, which leads to the blurred vision, is known as. So what is the thing where the definition is given here? Choose the answer for this one. Already explained the question. Students, I am waiting for your answer here. So do fatapat comment for this one. Yes, opacity of the lens where which leads to the blurred vision is known as. Option A is there glaucoma. Option B is there cataract. Option C is there retinal detachment. Okay. So among these all, you have to choose the answer and give the best answer for this question. Yes, option B, 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 B. Almost all are giving the option B. That is the 100% correct. So I will not waste your much time here. So this is the cataract. Cataract is the opacity of the our lens. Okay. So I will tell the parts of the lens that is helps to study the surgical intervention for the cataract. Okay. So this is what we call yes, our cornea in front iris muscle. So behind the iris muscle, yes, there is a lens. So it is holded by the suspensor ligaments. Okay. Also we call this one as the zonular fibers. Okay. So this and this anterior side we call this one as the anterior capsule, and this green marked one. Okay. So we call this one the capsule of the the cortex of the lens, and so I think we are marking with the black here. So this is what we call as the nucleus of the lens. Okay. So here we will get the adult nucleus, infantile nucleus. So only for us is important is the adult nucleus. Okay. So why? Because the cataract occurs after the adulthood only mostly. Okay. So in few conditions the congenital cataract also occurs. Okay. So in the congenital cataract, yes, the our infantile or yes, the infantile what we call congenital cataract. In the senile cataract, the cataract due to the aging process, the most common type of the cataract is the yes, our the senile cataract. Okay, so as the senile cataract, the nucleus which get damaged is the adult nucleus. Okay, hope the concept is clear. So this one is the posterior capsule. Front one is the anterior capsule. Nucleus of the lens. Okay, so why I'm telling this one means any degenerative changes due to the diabetic condition, due to the any metabolic abnormalities. So where the abnormal things will get opaque, will make the lens to make opaque. Okay, so here the lens is unable to get the light rays. Okay, so that is what we call as in the cataract. Okay, and whenever there is in the opacity of this one, so whenever you will see the lens will be completely transparent one. Okay, so after cataract, so this lens will be particular changes its color to the white. So in the cataract we will say the presence of whenever we will pass the red light through this one, so we are unable to reach the posterior part of the eye because of the opaque lens. Okay, and because of that the absence of the red reflex. So the absence of the red reflex and the presence of the white reflex. So that is indicating the cataract. And the early sign, if anyone is asking is the blurred vision is the early sign of the cataract and the common cause of the blindness in okay. So the answer related to the cataract is got clear here. So we are moving forward to the next question. Sorry. So we have discussed everything related to the glaucoma, and I will discuss now related to the retinal detachment in the this question. Okay. So yes, this is the already told answer here. The most common cause of the blindness in India is the cataract. If in case exam asking the most common infective infective cause of blindness is the infective cause of the blindness is the yes conjunctivitis is the most common infective cause of the blindness, and yes, non-infective cause is the or overall most common cause is the cataract. Okay, very important. And yes, hope the concept is clear for this question. And here is the next question. We will discuss the things, surgical things related to the our cataract. Then we'll move forward to the very important our retinal detachment things. Okay. So here is the question in front of you. So first solve this question. Then after that one we'll discuss related. Yes. The question is very simple. So in which of the following method of the surgical intervention, nucleus, cortex, and anterior capsule of the lens is removed, and jonular fibers, posterior capsule kept intact? Is this intracapsular cataract extraction, application, and photodynamic therapy? So, student, what happened here? As I told with the explanation of the parts of the lens, this is the anterior capsule, this is the posterior capsule. Okay, so inside we are having this one. Okay, this is what we call cortex of the lens. Okay, inside the cortex of the lens we are having the nucleus of the lens. Okay, so this is the nucleus of the lens, and this lens will be held by the suspensor ligaments or jonular fibers. Here in this particular surgery, the anterior capsule is removed. So I am clearing your question here first, then I will go for the answer. What are the things will get removed here, and what is they have kept intact? I will clarify here. Okay, so here they have removed anterior capsule, they have removed, means this particular fronts they have removed, and after that complete cortex they have removed, means this green color part also they have removed, and yes, the nucleus also they have removed, means this black color part also they have removed. So what are the things they have kept intact? And jonular fibers, posterior capsule kept intact, means this particular one they have kept intact. So what is the surgical name we call this one? So this is what we call as in the extracapsular cataract extraction, where we are keeping the posterior capsule and jonular fibers intact, and yes, the nucleus, cortex, and anterior capsule of the lens we have removed here. So that is what we call the extracapsular cataract extraction, along with the jonular fibers, anterior capsule, posterior capsule, cortex, nucleus, everything we are removing, means the answer would go for the our option A, that is the intracapsular cataract extraction. And in the phacoemulsification, we will use the ultrasonic waves, and we will break small piece of the lenses. So that is what we call as in the phacoemulsification surgery, and all these three surgery will be done in the cataract. Okay, so that is what we call as in the cataract surgeries. That is the ICCE, ECCE, and phacoemulsification surgery. And all these three difference between the all these three words I have told you. Okay, so the post-operative interventions of this cataract surgery, they have asked many times in the exams. Remember, always after doing the cataract surgery, the patient eye is get closed. Okay, so with the bandage, the prior to nursing intervention is there. Our eye is very much important and necessary for the looking over the things. Okay, if we have bandage in the eyes, means there is chance of the fall risk injury, and the priority nursing intervention in the post operative of the cataract surgery will go to the prevention of the fall of the patient. Okay, so then after that, what are the things we have to educate to the patient? We will always advise the patient not to bend forward not to sneeze, not to cough vigorously, and not to increase the intra-abdominal, intrathoracic pressure. So that can create the pressure inside the ocular, intraocular area. Okay, the further damage occurs in the post-operatively. So we will advise the patient not to lift the heavy weight more than the 5 pounds, and not to bend forward, not to rub the eyes. Okay, and very importantly, wear the glasses after removing the dressing. Okay, so these are the post-operative interventions, and the priority one is the always prevent the fog rest injury in the bandaged eye patient. Okay, so very importantly, remember and give the best answer in the exam. Okay, that is helpful for you all. Okay, and here is the next question. So students, this question I am giving as an assignment for you all. Yes, from this onwards, we will discuss in the tomorrow's class within detail again. If you found the content very much helpful and important for you all, do subscribe to the channel. If you found it is very important, ನಿಮಗೆ ಏನಾದರೂ ಕ್ಲಾಸ್ ಇಷ್ಟ ಆಗಿದ್ರೆ ನಿಮ್ಮ ಫ್ರೆಂಡ್ಸ್ ಜೊತೆ ಶೇರ್ ಮಾಡ್ಕೊಳ್ಳಿ. Okay, if you found and if you like the class, so do share the class with your classmates and all. We will meet again in the tomorrow's class with a clear, concise, and beautiful explanation for each and every question. So don't forget to hit the like button, and if you are new to the channel, yes, subscribe to the channel. Okay. Thank you everyone. Yes, I will take daily classes, students. Due to some personal reason, I were busy so much, so unable to take the classes for these many days in between. As we will maintain our consistency as previous, we have taken the 100 classes continuously in the only in between 2 months. Okay, so it's not a matter for me. Yes, I will maintain the consistency towards my class. Okay, you guys also maintain the consistency towards your studies. Okay, so I will be always there to support you, and I will always there with you. Don't worry. Just take the grace of the God and move forward. Everything will be fine. Okay, no need to worry and no need to think much about the new pattern. It's very helpful pattern for you all. So believe me, if you are reading the thing particularly with concept based learning, so the thing will be very easy for you all in the upcoming obstetrics exams. The question will form in the all three manners: easy, medium, and hard. If you are covering the easy and medium questions, then your selection will be 100% sure. So okay, I will come with the new strategies for the exams just before your exams. Okay, so whatever the instructions I will give, just a day before the exams, do that particular thing in your exams. Your selection will be sure. Okay, yes, we will meet again in the tomorrow's class, friends. Thank you for watching the video completely till the end. Okay, so we will meet again. तब तक के लिए जय हिंद, जय भुवनेश्वर.